Welcome everyone to today's webinar. I am Elder Abuse Prevention Ontario is pleased to host this session today with the Canadian Network for the Prevention of Elder Abuse. Then my colleague Benedict Shefflin is going to be co-hosting the webinar today and walking us through this. And the session also will be moderated by Margaret McPherson from the Centre for Research and Education on Violence Against Women and Children, and was the lead in developing the It's Not Right Neighbours, Friends and Families for Older Adults program. So before we begin, I'd like to deliver a land acknowledgement on behalf of our organization. We acknowledge that we gather on the traditional territory of a number of First Nations and acknowledge their stewardship of this land and its waters as protectors of the natural abundance throughout the ages. We seek a new relationship with the original peoples of this land that remains their home to this day. May this relationship be one of peace and friendship, based in honor and deep respect.
Hello, everyone. My name is Benedict Shefflin. Before we get started, a couple of reminders regarding the logistics of this event. As you probably know, if you've attended our previous webinars, this is a setting where all microphones are muted during the webinar to protect the integrity of the sound while we record, but you do have the option to use our chat box to post comments, to interact with each other, and as well, you can ask questions for our presenters by using the Q&A box that is at the bottom of your screen. What we will do today is going to be slightly different. Is for the first people representing Quebec, we'll be taking a few questions right then and there. And then for everybody else, we'll keep the questions for the end of the session. Ryan, if we can go back just one, please. In terms of the image, we do not have an ASL interpreter today, but worth noting in terms of your view, you can choose to have either the speaker view or the gallery view as you choose. And as Ryan mentioned, to activate the closed captioning to have it visible on your screen. You will be invited to take a short evaluation survey at the end of this session to help us figure out how we did and how we can do better next time. And you will also receive a same link to the evaluation survey in a follow-up email. And of course, as always, this session is recorded. So we are encouraging you to stay until the end, obviously, but if for some reason you cannot stay, not to worry, you'll be able to watch the whole thing online in, let's say, about next week, hopefully, within a week to 2 weeks after the event. The recording is uploaded to YouTube and to our websites, eapon.ca and cnpa.ca. And along with the recording, we'll be posting as well links to resources that are mentioned today, so you can investigate further if you want to. And then finally, because this is a recorded event and a public event, we are strongly encouraging you to be mindful of what you share in the chat box. We want to respect your privacy and confidentiality at all times, and we hope that you will do the same for yourself and for others. So if you want to discuss any particular specific personal circumstances or have, personal pointed questions, please direct them to Rayanne or myself, and then we will either answer them ourselves or direct you to the person who can answer. I believe that is it for the usual tips and recommendations. Rayanne, I'll let you introduce the APO briefly.
Thanks, Benedict. So for those who are just joining us for the first time on our webinars, just a little background about our organization. So Elder Abuse Prevention Ontario, our vision is to make sure that all seniors are free from ageism and abuse, where human rights are respected, protected, and advanced. We are implementing Ontario's strategy to combat elder abuse. We've been doing that since 2003. Our organization is funded through the Ministry for Seniors and Accessibility to implement that strategy. Benedict?
And here I am. Similarly, for those who don't know us, CNPA is the Canadian Network for the Prevention of Elder Abuse. So we are a pan-Canadian organization that is working to improve awareness, support, and capacity for a coordinated approach across the country to elder abuse and neglect. So I invite you to discover more on our website, cnpa.ca, And you can also look up futurus.ca, sorry, futurus.cnpea.ca, which is where you will find our national strategy on elder abuse prevention. And now I believe it is time to introduce our facilitator today, Margaret. Well, I guess we've already introduced you, but nice to see you again. We'll let you take the reins and kind of tee us up for this whole event today.
Thank you so much, Benedict, and hello, everyone. It's so nice that you would join us and be with us for this presentation. I wanted to start just with a little bit of context for the presentation. I do see this as being part of the progress report that we made last month on Future Us and the work that we're doing to advance a prevention agenda in Canada that is contributed to by many people in many different places. And so today we're going to focus on adaptations of It's Not Right. But it sits within the context of Future Us that was launched in 2022, put together by bringing together people and talking about what do we need to do to get to prevention in Canada on elder abuse. And a lot of that is about we need to engage everyone in the project of social change. And so we have 3 goals that we're working on around prioritizing prevention in every community. So every person we come in contact with, we're saying, you are part of this with us. Do what you can from the place that you are in. And so in your community, is the prevention of elder abuse a priority issue? It's a good question. And establishing and supporting prevention networks as infrastructure that connects us across the country. And then the 3rd goal is about teaching everyone to be able to recognize warning signs, indications of an escalating situation, how to respond safely, effectively, supportively, and where to refer in the community to find help. So those are the 3 goals that we're working on. And on the Future Us website, there are places on the map. You can put yourself on the map and tell us what you are working on. Because we have these tools, we put them out in the world, and we want to have a place where you can come and tell us about your contributions. Because it's like I think people feel like we're working in isolation a lot of the time. Well, this is a chance for you to come and tell us what you're working on. So today we're focused, this flows off of that 3rd goal about teaching everyone across the country to be able to know what to do when they see signs of abuse and neglect. And this comes from an evidence base. It comes from research that's been done specifically into domestic and family violence that says it's almost always the people right around the family, the couple, the individual who can see what's happening, but they don't know what to do about it. And so it's a strategic goal in saying that, well, if we prepare people to be able to respond when they first see the warning signs, we are actually creating a whole other first line of response that of people who are well placed to take action. And so helping people know what to do when they see that happen is what It's Not Right is all about. This is the website. There's lots of resources there. There is also a map there about It's Not Right presentations in particular. So this is where It's Not Right lives. And I was just going to tell a little bit of a story about it. It was created in 2005. It was the Ontario government. They made domestic violence a priority issue for the province. It was Neighbours, Friends and Families, which is a domestic violence public education campaign, part of the Domestic Violence Action Plan. In 2009, the Public Health Agency of Canada contacted us at the centre. We managed the program, Neighbours, Friends and Families, for the province of Ontario, and asked us if we could adapt it for elder abuse. We were thrilled to get that call. and excited to work on the issue. But I said only if we can connect to passionate people, experts, advocates all across the country. And so we formed a community of practice, and It's Not Right community of practice that is still going today. And it was that group, we did all kinds of consultations to develop the materials around what people need to be able to recognize, respond, and refer. So the materials were created. And then in 2012 to 2015, there was a large grant from the New Horizons program where we had a chance to develop scenarios and stories and more materials to put the materials into the hands of people in different provinces and territories. And over the course of that project, we did visit every province and territory where there were presentations done and people were trained to deliver the materials. And so this is the most interesting thing for me is I visit places and I hear from people who said, I was at the workshop in 2013 and I'm still delivering that material. The materials are that good because there were so many people who developed the stories. There's a lot that people can relate to. We had, we wanted to have sort of a diversity of stories available in the sort of the 10 scenarios and responses that we produced to support a bystander approach in addressing the issue. There was an Indigenous scenario produced that was created in northern BC by a group of elders and youth. It was actually one of the women, one of the elders there, Florence Barnaby, I think, who named It's Not Right. And then we created a Muslim scenario as well, working with a group of from the Muslim community in London who sat and talked together about what's the story we really want to tell about elder abuse. And there was francophone videos produced and materials in consultation with. So you're going to meet Sarita a little later in the presentation, and a group in Montreal who looked at what do we need to do to adapt. So I tell you that because there's always been this vision of It's Not Right as providing kind of a smorgasbord of materials that are not meant to be a universal story, but more about picking them up and starting conversations in your community. They're a place to start. But the real important work happens with those conversations and when people talk about how is this different for us? How is this the same for us? And what we found over time is that the stories do resonate for people in every community we've been in. And there are differences that we want to acknowledge and support. So there's networks, I've listed them there, and there have been provincial, territorial investments from those governments to enhance, to take It's Not Right into the communities. And it's become kind of a core program in these places with and without networks, which is very interesting. And so that work is all ongoing. What we wanted to do today was to give you a look into some of the adaptations that have happened through funding from provincial territorial governments and the innovation and energy of incredible people doing the work on the ground. And so the first presentation, so we're going to have 3 presentations, and Jose and Sarita will tell you a little more about themselves and the work that they've been doing. And then we'll take some questions because Jose's got some internet issues and may not be able to stay on the call. So I'm going to turn it over to Sarita and Jose to tell us their story of adaptation.
Hi, everyone. I'm Sarita Israel, and I'm the coordinator of a domain of expertise to counter mistreatment of older adults. I'm also the person carrying the It's Not Right project for Quebec. And Jose, I'm going to let you introduce yourself.
Yeah, hello everyone. I'm José Duplanty. I work for the regional health board. Oh, sorry, my English is so bad. The health board in Nunavik, and I'm the coordinator for the fight against mistreatment in Nunavik also. Go ahead, Sarita.
Okay, so I'm going to be the presenter for this presentation. However, there's been significant contributions from José Duplanty, who is the one who has adapted and is working on the adaptation of It's Not Right for the Nunavik communities. But I'm also going to present to you what has been done for the Cree community as well. And that was prepared by Laurie Bergeron. So first of all, I just want to tell you that we did, like Margaret said, we did meet in Montreal, and we did have to do some Quebec provincial adaptations. So the first thing was, and we collaborated together, we had a grant to do so, was to adapt it to Quebec French language. And also some of the activities that were seen in some of the videos were felt that were not appropriate for the Quebec population. So we adapted some of those. So we redid the videos using well-known Quebec actors. And a part of it is to favor, engagement and feel represented. What we did as well was Quebec has an action plan to counter mistreatment. That action plan has a particular specific terminology. So we adapted the training tools to reflect that terminology. We also created a website. Of course, in Quebec, we work in French, and the program is called Ce n'est pas correct. So the website, here you have it, is Ce n'est pas correct to access. And of course, we do have all the materials in English and in French, but the website is accessed through the French name. In 2017, 2018, it's the provincial regional coordinators for the action plan to counter mistreatment that were trained to diffuse the program across the regions or the populations that they serve. And this is when they actually started to realize that maybe some of the materials had to be adapted for their population. In 2023, 2024, there was some changes in terminology. So once again, we readapted the program, we simplified it, and we trained again all the regional coordinators for a fresh diffusion. So now it's freshly being diffused. So for the Cree communities, there was specific adaptations that felt that were needed. So they started in 2020, 2021. There was adaptation started by Brenda House from the Cree board. And the adaptations included the inclusion of illustrations that represented their community, terminology, a set reflective of the people, the culture, and the language. And also in Quebec, in our action plan to counter mistreatment, we also work on what is called good treatment. So the inclusion also of the concept of wellness care. In 2020, they actually created a dedicated Cree helpline, and that line meets all the psychosocial needs of Cree communities of the James Bay, and the services are available in English as well as in Cree, and that is the resource that is used when the presentations are given. We have a provincial resource, La Ligne Aide Maltraitance Adulte Aîné, which is for everybody across the board, but they have their own helpline, which can answer also in Cree language. So finally, all the adaptations were finalized in 2024, and it was diffused at large. And it's actually been a very successful program. It's been used to sensitize frontline workers, different partners, and you have the list of the different people that are involved, and they're gradually going across the general population. So I'm going to share with you, first of all, what the wellness care concept is. It's an approach that basically values respect and the respecting of the needs and the choices of older adults and individuals in general, including the right of refusal. And it's very centered on having the right attitudes and interpersonal skills in order to be able to ensure that the rights and freedoms of all individuals are respected. And especially, that they exercise their choices in a care context. And this is expected of individuals, of organizations, and all communities at large. So I'll show you that in their PowerPoint, for example, they included, they gave the definition of what wellness care is, and they asked different people, in the audience to say what they felt, were examples of wellness care for older adults and vulnerable persons. Also, when I said there was an adaptation of terminology, in Quebec, we stopped using the term elder abuse because it was felt that elder was a term to be really, that was for specific to First Nation communities where elders has a specific, position in the society. So they went and they put it back in and they used elder mistreatment. So this is a poster. You see, they chose to have figures that are more reflective of their community, and they give the resources that are their very own resources. And as you can see here also, they have a promotional pamphlet, and it shows more the context in which these communities live and their connections to I would say the earth and everything that's nature, which is very important as well. And as you can see, also some translations were done in Cree as well for certain aspects of it. And they actually give a lot of information on the program that participants can walk away with. So now I'm going to turn a little bit to the adaptations that was done for the Nunavik communities. So number one, it's a very fresh start. It's just been started last year, and we're working on it this year, thanks to José. And here it was important to have, again, more images and materials that are more culturally meaningful for the population and visually engaging. We actually, I believe, had one of the videos, you'll correct me, José, that the subtitles were done in Inuktitut, because actually with the Nunavik communities, a lot of the elders speak Inuktitut more so than English. The primary language of the workshop is in English. However, there is Inuktitut as a secondary language. There's always an interpreter on hand at the workshop to ensure the participation and the full understanding. So here you see how they've changed. We don't no longer have the signature of the It's Not Right project as you see it, but they have their own. And again, there's that sensitivity to, or that approach that starts with the wellness care approach, which is the promotion of respect and safety of older adults. So that's what they have used as the signature for the program. Also, as you see, there are translations that are done in Inuktitut for the PowerPoint. And it's actually, the images are beautiful. The artwork has been exceptional for this project. What's different also is they adapted the length of the presentations to be more in line with what the needs of the community are. So this is a full day presentation that's done. And it's to allow meaningful exchanges, also time for reflection and silence, which is actually very important for their community as well. There's emotional support that's available throughout the day if anybody needs it. Also, what they have done, which is very interesting, is they have backpacks, promotional backpacks that are given to participants at the end of the presentation of the day. And for them, it becomes a tangible teaching tool and reinforces the activities and messages of the program, basically looking at respect and safety. So here's a picture of the knapsack that is given at the end of the day. So actually what I've given you, since I'm not the one that has done the adaptations, you do have here for anything to do with the general adaptations that were done in Quebec, you can reach me. For the Cree community adaptations, Laurie Bergeron can be reached, and that's her information. And here is José's information regarding the Nunavik community adaptations. I'm going to stop the share now and maybe give you a chance if you have any questions for myself or for José, who may not be able to stay with us very long.
I have a question.
I'm interested in the conversations that you had, José. Did you find it? So you used It's Not Right to start the conversation, which was, what we'd originally hoped for. Was it trouble? Did you have any trouble engaging people in the discussions?
Not during the workshop. It's to bring the people to come to the workshop. It's still a challenge for sure. we have to find ways to get them, because the workshop, it's just great. People take time to exchange, take time to silence. It's the workshop, it's just okay. It's really perfect. I've exchanged with an elder about it, and she told me that everyone in the community should have that workshop. It's just to bring people to come to the workshop that's still a challenge, and we have to find ways to get them. But during the workshop, very, very nice.
That's a kind of an old problem. How do we get people to come? So obviously you were successful. Do you have any sort of strategies, or how did you do that?
No, it's still a challenge. It's still a challenge to get people to get them, but ways that we're thinking about is even to go to radio, to say, hey, there's that workshop, and just telling that we're speaking also about well caring. It's very a positive thing.
Yeah.
So because we know it's not a way, it's not a opposite of mistreatment, but it's a way to protect also. So, and thinking a positive way of it, that brings us together. Maybe an easy way, but so we still have to think to see how to reach the community to come, and it's even a challenge because we are 14 communities, so I can't be the only one either to give all those training. We have to find a way to have trained the trainer, absolutely. So it's going to be given by the community to the community also.
I think I want to add something whereby the Cree community has had a coordinator for the regional coordinator for the action plan for a very long time. Nunavik did not have a coordinator, and therefore they're not as advanced also in the awareness on mistreatment as a whole. So much harder to open the conversation. They're still at the very beginning regarding mistreatment. It's just that the laws have come in and they're being confronted, with having to do something, but they have not had the same support. They do not have the same financial
Yeah.
resources to put a line that's dedicated, etc. So this is tremendous work. That's why, José's implication and the fact that José has now been appointed as a regional coordinator that has stayed more than a few months, because there's been trials in the past, but it's been very difficult. Lori, it's the expansion is incredible of the program, because there's people already working on mistreatment and people are engaged and they have resources. So I think that also is part of the challenges. They're actually being the pioneers in opening the conversation on mistreatment, which is always
Yeah.
difficult in a community.
I can see there's a lot for us to talk about, but I do want to get to the other presentations. And I really appreciate your time and the work that you've done. These are beautiful presentations. I saw a question about how are they available that we can talk about, because other communities are interested in the adaptations as well. And I know you've been generous in talking with us about how that can happen. So we'll continue to do that. So thank you very much. And we can take more questions at the end as well. So I'm going to invite Karen Willie to join me from the NWT Senior Society. And Karen, I have to say, it's an interesting sort of segue into your presentation to hear the story about by the community for the community.
It is. We have taken a very different approach than Quebec, but hopefully we can share stories, because I think what they've done is also really interesting for us.
Yeah.
NWT Senior Society is a very small nonprofit organization that really is about advocacy. We were incorporated in 1983. It's governed by a board of directors that are from communities across the NWT. So there's 33 communities, but we obviously don't have 33 board members. The society receives project funding only. We're funded by the Government of the Northwest Territories Health and Social Services, the Government of Canada Women and Gender Equity, and New Horizons for Seniors programs. There are 2 full-time staff that work on projects currently. The mandate of the NWT Senior Society is dedicated to promoting the independence and well-being of older adults through advocacy and the delivery of services. Our vision is a society where seniors age well and have choices. And of course, preventing elder abuse is a big part of that. The Society delivers several services, including the Seniors Information Line, the Senior Advisory Council providing advice and support to governments on issues that impact seniors, which is every issue, elder abuse awareness, train the trainer elder abuse workshops, and participation in many social development issues, including family violence and housing, community-based senior services sector development, homelessness, and the development of an NGO sector for the NWT. Historically, the NWT Senior Society has provided the It's Not Right workshop across the NWT on the prevention of elder abuse. Both the NWT Network for the Prevention of Elder Abuse and the communities expressed concern that both the definitions and the workshops did not meet the needs of the communities. They wanted elders to define elder abuse in words that they understood, and they wanted culturally safe and relevant elder abuse prevention workshops delivered by community members. We heard them. This, I'm proud to say, is a book written by elders in the NWT where they define elder abuse that just went to the printers about 15 minutes ago. So what we did, De Beers Canada, a diamond mining company in the Northwest Territories, and the Government of Canada Horizons for Seniors understood our vision. 3 workshops were held in the Northwest Territories that included participants from the Beaufort Delta, North Slave, South Slave, and Decho to redefine elder abuse. That's not going to mean much to many of you, but that is 4 out of 6 regions. The elders were from a variety of communities, including regional centers and small isolated communities. 26 Indigenous elders participated. The goal of the project was to redefine the terms that encompass elder abuse using words, examples, and scenarios that elders would understand. All the definitions, examples, and scenarios in this project were written by Indigenous elders. In the workshop, the elders wrote definitions, developed examples, and real-world scenarios to ensure a broad understanding of the terms. The terms defined by elders included physical abuse, emotional abuse, sexual abuse, financial abuse, and neglect. They also decided there were other types of abuse that were not included, and they wanted to include them. They were spiritual abuse, cultural abuse, technological abuse, and systemic abuse. One of the scenarios I'm going to read to you right now, it's a financial abuse scenario. Jim, a 20-year-old, asks his grandmother for $60 for school supplies. She agrees to give it to him. When she goes into online banking, she notices that the money has already been transferred to him. Grandma asks him, "Did you already transfer the money? How did you get into my account?" Jim answers that he went into her computer. Her client number is already there, and she always uses the same password. He says, "It was easy." His grandmother says this was planned and it is an unauthorized use of her money. Jim swears it will never happen again. Grandma changes her password. The trust between grandma and grandson is broken. So that was written by one of the elders in one of the workshops. Funding has been secured from the Government of Canada to design and print a booklet with these definitions, examples, and scenarios in elders' words. We hope to release the booklet in June, and now we know we will be able to do that for World Elder Abuse Awareness Day. The book includes the illustrations you're seeing right now. Radio ads are being developed using some of the scenarios, both in English and in Indigenous languages, including Tlicho, Gwich'in, North Slavey, and South Slavey. They will be played on a territorial-wide radio network, CKLB, the week of World Elder Abuse Awareness Day, June 15th. The definitions are used to train community members to deliver elder abuse prevention workshops. So this was step 1 in our change. The second was we designed a Train the Trainer elder abuse prevention workshop training funded by the Department of Health and Social Services, Government of the Northwest Territories, and they have given us now 2 years funding. So this project will have had 3 years funding by the end of next year. The goal of this Train the Trainer is culturally relevant and safe elder abuse prevention workshops across the NWT. In past, it has been the executive director of the NWT Senior Society who has tried to deliver the prevention workshops in 33 communities. But given the number of communities and one person, it means can only do a workshop every 7 years in a community. And that's just not good enough. The NWT Senior Society offers a 3-day workshop to staff or volunteers of Indigenous governments, non-government, and seniors organizations across the NWT. In this participatory workshop, those attending learn facilitation skills, principles of adult learners and learning, adult learning strategies, and expert information on elder abuse. Participants then deliver a lesson to peers for feedback. Participants are encouraged to develop or edit materials provided to ensure cultural safety and relevance in their communities, because that's what this is about. During the training, participants receive the facilitation guide, which you're seeing the cover of right now, hard copies of the resources, a thumb drive with the information and resources on it, and a certificate of completion at the end of the workshop. But that's not all. Part of the program includes mentorship. This means that the executive director, who also delivers the workshops, will co-facilitate the first workshop with a participant in their community. Unlimited online or phone discussions while they are organizing the workshop and developing their materials, and a facilitators network that meets quarterly to discuss facilitation strategies and share experiences. All of this is intended to support people who haven't facilitated in the past. Parts of the It's Not Right program are incorporated. The workshop's free. Participants from out of Yellowknife receive transportation, accommodations, and per diems to attend. Included in the training is how to organize a workshop, how to budget, and how to apply for funding. To date, we have held 2 sessions, one funded by Service Canada and one by the GNWT Health and Social Services. 15 people from communities have been trained. We will be organizing the 25-26 sessions shortly. Other GNWT and arm's length organizations such as Aurora College cannot be funded to attend the Train the Trainer elder abuse workshops. However, there is still a need for those organizations to be trained. We have agreed to guest lecture on elder abuse at Aurora College with nursing and personal support worker students. We have also agreed to travel to health facilities in communities to deliver the 3-day workshop if the facility pays the expenses. Finally, if some health organizations can't fund an entire delivery, they can send staff to our training, but they must pay the staff's expenses. We hope to be as inclusive as possible. Thank you.
Thank you so much, Karen. That is such exciting work. And I'm sure I have questions, but we'll wait till the end. We're going to move to Alberta now and some of the work that's happened there. I was part of a project with Immigrant Services Calgary just before the pandemic, where they brought, I went in and did training. So I trained facilitators on the It's Not Right content from a variety of ethnocultural communities. And then they took the content into their communities to workshop it with just members of their communities. And from there, they did make some adaptations to the slides, but they also did translation to the PowerPoints and to the videos, so that they felt that the videos were very useful in telling the story, and it stimulated a lot of discussion. So they just wanted to apply subtitles to them. So we were able to do that together. There's a lot about that process, right, of taking it in and having the conversations about what's real and meaningful here. Like, that's the whole point of engagement. So next then, I'm going to introduce Jennifer Wells and Myrtle Beaulieu and April Tucker to talk about the work they've been doing through the Alberta Elder Abuse Awareness Council in Alberta.
Thanks, Margaret. My name is Jennifer Wells, and I'm the community trainer with the Alberta Elder Abuse Awareness Council. And my job is to really make the program available, the It's Not Right program available across Alberta. So we have in Alberta, we have 46 First Nation communities and 8 Métis settlements, as well as a number of Indigenous people who live in urban centers. And so this year I've been working with our 2 Indigenous liaisons, April Tucker and Myrtle Beaulieu, to do some adaptations for Indigenous community, for the presentation on Indigenous communities. So today, they're going to talk about what we've been doing in this process, where we were, where we're going, what's next. So I'm going to start with April. April, when you I'm going to start with Myrtle, sorry. Myrtle, when you and April were hired, the It's Not Right presentation really was not being delivered in Indigenous communities. And so I wonder if you can tell us what work was required to sort of be invited into the communities and talk about elder abuse and do the presentations. You're muted.
Sorry. Just give me 2 seconds here. Sorry about that. Hi, my name is Myrtle Beaulieu. I'm a Métis person, and I am presently serving as the Indigenous Resource Liaison for AAC in Alberta, and working with awareness and education in Indigenous communities. Yeah, there wasn't anything available last year when we first started our jobs to work in Indigenous communities. And we would gather, and talk about, well, how could we start and begin to work in Indigenous communities? So what we did was we felt that we needed to build relationships and trust with communities, which probably the first 6 months, that's all we did. And how we did this was, part of it was, I've worked in Indigenous communities before. I've lived up north in northern Alberta. So I had lots of connections that I reached out to and asked for their help to connect with Indigenous communities. And then last July, the AAC executive director, Joanne, and I did a road trip from Grand Cache, which is near Jasper, all the way up to High Level, covering communities like Grand Prairie, as well as Peace River, and everything else in between. And we wanted to introduce our organization and collect information from the communities of the needs of each community around elder abuse. So the other thing is we included in-person meetings such as that one with that trip. I also attended different events like round dances, the MMIP events, and I also connected to Indigenous interagency groups, which were quite successful. In some of the people that I knew from Grand Prairie, hooked me up into the interagency groups, and I'm on their email list now. So I find out about different information, different events that are happening. We did, of course, word of mouth is always a good thing to get support from others. And also just having lived experience, I guess, being Indigenous ourselves. So those are some of the ideas that we did to connect and build relationship.
Great. Thank you, Myrtle.
Mm-hmm.
So April, to you. we started considering presenting about elder abuse to Indigenous communities, we felt that the It's Not Right program was really a good fit, but required some tweaking to it. So why do you think it was a good fit? And what were the initial changes that were made to the program?
So for me, when it comes to our Indigenous communities, it's about community. So often we use sort of through a westernized lens, like bystander training, including friends, neighbors, family. But as far as our Indigenous communities go, we're more based on a community, including like natural supports and people living next door, aunties and uncles, cousins. So it comes down to really being about family. So for us, just seeing that and being able to ensure that our elders, and I know that in some communities we don't want to say elders, Katayak, older people. So every nation that we sort of adventure into, it can be different. But yeah, so as far as having, it being bystander training, we just want to reflect on sort of more of an Indigenous holistic approach. And this also includes incorporating those supports for the person causing harm or mistreating the elders. So it's not just about one person trying to make a difference in the elder who is experiencing this mistreatment, but it is about the whole community.
Great, thank you. So you've come a long way. It's just talking about where we are now. So Myrtle, the presentations that you two have delivered quite a few into the communities now, and I know that you've sort of been working and honing your skills in this area. So what are some of the practices you have when presenting to Indigenous communities, and how have those presentations been received?
Thank you, Jennifer. Yeah, so each community is different. So we have First Nation communities, nations, as well as Métis communities, Métis settlements. And so they are different. We found like the protocols are different, where some people may want the land acknowledgement, or some communities want a prayer. So I kind of phone ahead and talk with the person that I've connected with and ask them, well, what's your community want? Do they want a land acknowledgement? Do they want a prayer? Do they want a smudge? In some communities, I know April has done the smudge before some of the training. So, they're all different, like I said. So we definitely want to make sure that we know what the community wants before we go there. What I've also done to kind of, when I do go out to communities, is I spend time with the introductions. I don't just say, hey, can you just tell me what your name is? And I want to know more about them. I want to know their name, the community they're from, and just ask them a personal question. And we spend time talking about them and their community. And I think that helps build relationship like automatically, and it seems to work for me. So that's kind of what I do. And then we get into, what the bystander training is about. Like April said, the bystander training is for your cousin, your aunties, all the community people in your community. So it's not something that we're coming in and teaching them and then leaving. And I think that's been kind of historical, where people come into the community and they may present something and they leave. I tell them we're not going to leave. We're gonna come back. We're gonna help them in any way that we can and connect them to resources and that type of thing. So that's kind of some of the things that we do. We can use translators in some of the training that we do. We are also adapted It's Not Right to include the word elder if they need to. I usually say, I can use the words interchangeably: elder, older person, senior, whichever works best for the community. If they, don't prefer me using elder, I won't. But I do ask that permission before I start any kind of it's not right training. I guess some of the barriers that is the travel. I work in northern Alberta, so when I said we went to high level, that's almost 8 to 10 hours away from where I live in Bonnyville. And so it's difficult, the financial constraints that we have to be able to reach some of these northern communities is very hard. So it's kind of, and a lot of the other barriers is a lot of communities don't have, they may not have good cell service, they may not have good internet service. So it's really hard to do anything on Zoom. It's best to meet in person if you can. So that's kind of some of the barriers that we're working with in the Indigenous northern communities as well. I believe there might be some in the South too. April may want to, expand on that. But yeah, so there's basically that's about it.
Awesome. Thanks. Thanks, Myrtle. So April, let's talk about what's on the horizon. It's actually only been about a year, might feel like longer, and it's amazing, really, how much you two have accomplished in this. Can you talk about you try different ways of communicating and the words that you use and ways to illustrate a concept? And what do you see as the next steps for the It's Not Right program in Indigenous communities?
So I just wanted to, I don't think I actually introduced myself. And I think it's important that I do because this is where this future stuff comes into play. So I'm from Six Nations Reserve in Ontario. And I know that just from growing up, the respect we had for our elders was significant. There was no questions about it. However, you do see because of intergenerational trauma and histories and the ripple effects, we do see these challenges that our elders are facing. So as far as going forward and moving forward, for me, it's always been about, you know, the youth. And growing up, our elders said, take care of your youth, and they're our future. But now I've come full circle, and I'm here supporting our elders and ensuring that we're advocating for them and their voices. So when Myrtle and I first started out with our role, it was, we know how challenging it can be when we are going into different nations or Métis settlements. Oftentimes our elders are asking who we are and not where we're from, but actually who we are. Are we Indigenous? Are we Métis? So that's kind of where that relationship building starts for us, as far as the nations and settlements that we've been able to attend. So when we started, it was just going out, bringing out our handbooks. But now for myself, because I don't live such far distances as Myrtle, I've had the opportunity to not just be able to drop in on the nation, but also talk to leadership and bring in those elders for the elders gatherings to do sharing circles. So over the year, I've been able to sort of, understand what the elders are needing. And it really just comes down to having conversations with them. So the way that I've been able to build the relationships with the communities that I work with is actually through sharing circles. So I'm getting their information as far as, somebody that they know in on the nation, or it's a family member that they know that are experiencing elder mistreatment or harm, but also not wanting to water down the word abuse. So Myrtle and I do use this word interchangeably because we're not always talking to the individual who's experiencing abuse or mistreatment. We might be talking to the person who's actually causing the harm. So we want them to understand and recognize that this is serious and that we do want to support them as well. So when I do these sharing circles, a lot of the elders will talk to me about their experiences or somebody that they know. And so the sharing circles have been very effective. And I have felt very lucky. There's been a great positive outcome as far as being able to get on the nations and build those relationships. But moving forward, as I mentioned, I've worked a lot with the youth in my past, and now I've come full circle. So working on some of the nations, we've actually had conversations about Katayak, which is older people, in Cree there in one of the nations I work with, that their elders actually do work in the school systems with the young people. So now our next project is to get onto the nations, train the trainer, which is our elders, so that they can present these presentations to their nation members and to the younger generation. So the people of these communities, they should be learning from each other. And there's been a really good positive sort of they've been really receptive to the idea of this. So I think in June or end of June, early July, we are going to do a presentation for the elders that are part of that program and do the teaching to them. And then they will go on forward and teach their younger people and the rest of the community members on the nation. And then lastly, while we are still sort of revamping what our INR NFF looks like, we do want to really incorporate and reflect that Indigenous worldview visually through the artwork and symbols and images that sort of speak to our cultures, and just exploring that and how we want to do that in a respectful and collaborative manner, ensuring that we're following protocol and utilizing our knowledge holders and knowledge keepers and elders. So yeah, so that's kind of where we are right now, and it's really exciting. And we look forward to seeing how the INR and NFF presentations continue to evolve alongside our Indigenous communities, and that it's an honor for both Myrtle and I to really be walking alongside them and making sure that their voices are heard, and it's what they want and how they want to see it. It's not like what we already know or what we practice. It's how they want it to be presented and how they want it to be seen in their community. And it just makes it so much easier to bring us in, and just it allows us just to be a part of what it is that they want to teach their people. So
Awesome. Thank you. So thank you, Margaret, for a chance to tell everybody about this.
Well, it's exciting for me. It makes my heart sing to hear your stories about this, because, the vision was for a pan-Canadian approach in engaging people. And that means the tools they're just tools, and it's people picking them up and using them in their communities that gives them the power, I think, to connect us together across all communities. So thank you so much to all of you for your presentations and the work that you're doing. We are at time, but if people can stay for a few minutes, we could do some questions. Would that be okay, Rayanne?
Yep, we are. Yep, we have about. We don't have. If people are able to stay, that's great. If they have to leave, this is recorded so they can join us after. But there are a couple questions. There was one question about, would the workshop be available to individuals outside the Northwest Territories in the future? So
That's an That's an interesting question. I really hadn't thought about it, but it is a discussion I can have with my board and see. It really is developed for the Northwest Territories using the people from the Northwest Territories. But let me see how that goes, and I'll let you know.
Great, thank you. There's also another question about, this is from BC, a question for the, I believe, Myrtle. I work in the Indigenous communities in the northwest of BC. I'm wondering if there's any interagency group specifically to BC that you might want to point them towards, or for help or assistance.
Oh, I don't have any connections in BC, but definitely, and like I said, because of my background in the jobs I've done previously, I had connections kind of everywhere, High Level, Grand Prairie, Peace River, all those places. So I was able to easily, ask if they could be put onto their interagency emails. Yeah, I'm sorry, I don't have anything in BC.
We do have colleagues from the, may encourage you to go on the website for the BCCRNs. I'll put that in the chat box. They do have a link to the different networks across the province. And I do believe there are some communities that are doing education in Indigenous communities. So perhaps the ED or some support. I know April Struthers is online. So perhaps there's someone that can connect you to someone in that region.
Perhaps friendship centers and that type of thing also may have connections to interagency, specific for Indigenous communities also.
Great. And then there was just a go ahead, Meredith or Margaret.
I was just going to add one thing. I think this is the beginning of a conversation too about sharing resources. Sharing, like we haven't even really had a chance to, this is the first time we've seen these together in this way. And I think it begs for more conversation about sharing the resources and getting into other communities, and so that we're not duplicating. So I think always we're making the case for strategic investments from all levels of government to support this work. Like you see what these people have done, it's amazing. We need to be advocating for funding that allows you to keep doing what you're doing. Was there another question, Rayanne?
There was just another question about if the program's available to, is the program only available to Indigenous communities, which I believe is available to anyone, right? That's correct. And I guess the question, from Sarita, because it's a train-the-trainer program, is how It's Not Right is ruled out, how do people access or get the materials if they are from Indigenous communities or they wanted to learn from your work?
So basically, it's the regional coordinators. And that's what you have with Laurie Bergeron and José Duplanty. They are regional coordinators for the action plan. She's with the Cree board, Laurie Bergeron, but she's also coordinator for the action plan to counter mistreatment. So they're the best person. So anytime you call Quebec or you call me, I will always send you to the person who's working the areas, working the region, because they may have adapted. And I must say also we have a lot of cultural communities. A lot of work has been done a lot of different cultural communities, and they have adapted words and have adapted the way they present, and they co-present with people that can translate. So there's a lot of work that's been done for anybody who's taken on the project for it to work and for people to feel that, it corresponds to them. So we have a provincial coordinator for cultural communities. So that person too could be available in terms of specific things that have been done for about 9 different communities in Montreal. So I always have the list, and also I could get you the list also, Rianne and Margaret, but it changes rather frequently.
Okay, excellent. Margaret, do you want to, I have a couple of final slides, but there's one more question. Are there new videos that we can use for the training? I don't know if when you do the adaptations, if it was just only in print or if it was videos that were also done in conjunction with that.
As far as I know, there are no new videos. We are working with videos that we produced in 2015, but we're getting the most out of them. But I think those are future projects. It would be amazing to do that process of creating the videos with the communities, like with a variety of communities. So that's work we would love to do.
But we just have a couple slides that we do have our Aging Vibrantly podcast. So maybe we can have one of our guests here on one of those podcasts that's going to be launched for season 2. We have World Elder Abuse Awareness Day. I think Karen and a few people referenced that's coming up. So we are collaborating again with networks across Canada to host that on June 11th. And you can register for that event. We'll be having more promotion stuff coming out this week for that event. And if you want to get in touch with either CMPA or our organization, please reach out or follow us on social media. And we post things on a regular basis. And we will be doing more of these education sessions, I suspect, Margaret. We will post all the links as well with the recording. Like Benedict said, just give us a few days just to get that up, and we'll have it ready for everybody. So, Margaret, do you have any last words?
I don't. Thank you so much for the work that you're doing. Not only is it innovative, but it's beautiful. So thank you so much for what you are all doing and every day. So thanks very much, everyone.
Thank you. Have a great day.